the management. As to the management, how would you move forward? Any comments, any views, any thoughts? You know the history, the examination has been done. Now, for the management aspect, how would you move forward?
I think we must first assess the risk factors he already has.
Mm.
One thing that I noted is the overweight. So we must think of giving a suggestion how to reduce the weight to the optimum level,
Very
which
true.
may go a long way in recurrence.
Right.
And as I told about the posture, the day-to-day activities, how they sit and stand and bend and do any work. Another thing I want to vary from Lalit, that there's a big dilemma regarding lying on the bed. Earlier, I remember years ago, they asked to lie down on the flat board. Now they say it's wrong because they have a curve and they have to lie on a normal size mattress with one pillow. Even if there's any back pain, some people say, no, mom, biba nidagattama kakkuma yano. What have you got to say about it, biba posture?
I think I'll be coming to that slide
Yeah.
in a moment.
I will describe.
Okay. Yeah.
Okay, because you have to tell all that
Yeah.
to your
Okay.
patient.
Fine.
Another thing that I find is she's overworked. So you might have a discussion with the husband
Right.
and how they can share the work and especially take the children up and down. That's all comes to my mind.
Thank you very much. That's excellent. Any more takers? Anything else you want to? Okay, I will just share as to my management plan so that Dr. Lalit as well as the audience can comment on it, which will make sure that I will be managing my backache patients better from tomorrow. No investigations were done as it looked a lumbosacral sprain. I explained to her the possible reason for the pain, reassured her, and the treatment given by me was as follows: piroxicam, omeprazole, and diazepam. The doses are given there. Advice on lifestyle modification was given as follows: not to bend to pick up things, but to squat and get it. Use a hard bed to sleep, or use a mat with one pillow to sleep on the ground. Use a shower to bathe. If she is using a bucket of water, then use a low stool so that she doesn't bend when she takes a bath. The other advice given was as follows: something in regard to weight reduction by reducing on her high calorie consumption in her diet, but then I didn't touch on it in great detail because she is in severe pain, and this is not the point of time for me to talk about at this point of time less relevant aspects, because she wants to be pain free, right? So I thought I will keep it for the next subsequent visit. I advise to get some home help if possible, as Dr. Mota said. And I also advise to bring her husband if possible to explain about her sickness, and if possible to request for sharing of her work responsibilities, which I thought was very important because he is the only adult at home other than the 3 children. So I was a little worried about the husband not appearing on the scene. So I just mentioned to her to bring the husband and come. I also wanted to talk about exercise because weight reduction means diet and exercise. Again, for obvious reasons, I didn't want to touch on it. I reserved it for the subsequent visit. And a review was planned in 5 days' time. Again to Dr. Lalit Vijayaratna as to his comments on whatever has been discussed up to now.
Thank you, Shekhar. Yes. Yes, at this point, well, we have taken a good history, we examined the patient, extracted a lot of information. And if I summarize, at this point, I will try to put my information in front of me. If I summarize here, we have 45-year-old obese lady with backache, acute backache, short duration, with tenderness of the lower spine. The neurology or the lower limbs are normal. With those information in front of me, I'll, like any one of you, I like to work out a differential diagnosis because, remind you again, there are no red flag signs. I'll always check with that. There are no red flag signs, so now I can move it forward. That means I can keep this patient with me and manage this patient, because always as a GP, I know when you are confronted with such a situation, you always ask yourself, am I going to keep or am I going to refer? Can I manage or should I give over? Still, you can manage because there are no red flags, and it's acute backache for 3 days. So this will be my differential diagnosis with the information in front of me. Prolapsed inferior disc is out because neither in the history or in the examination there was evidence of nerve root involvement. And osteoporotic fractures was very unlikely because they are the pains usually in the lower dorsal, and the characteristic thing is that the pain radiates sort of like a girdle or like a tape. And they also complain that changing posture is a lot of pain, and a lot of other factors are there. So it clearly focuses on the first category, the mechanical type, or what we call as just a strain of the soft tissues of the spine. I'm quite happy. I will not perform any investigations at this moment because it was necessary. And my management plan, or what I would expect my general practitioner or just to follow this, I take them. Reassurance is very important. I don't know whether how many of y'all have suffered with that. I myself have suffered about 5 years back, and I am to tell you, even as a rheumatologist, it's very scary. Very scary. Because you can't see, sometimes you can't blend, and all sorts of things. So I can imagine what a day people are like. And when I talk to my good decades, I know how much they are distressed. So each move, your body language, your question, every time you should be reassured. You should never sort of indicate to the patient that you are suspecting. You always look very carefully into your eyes. Always your language, your mannerism, everything should be very soft, very gentle, and reassuring. Just to quote some evidence, you have to remember that 90% of different many patients with low back pain may come to recovery treatments. That's good news for you, which means that you can manage patients at all. You don't need tips and patients to us. And by a certain statement, this is what I'm quoting an article which came sometime back with DNG. Patients who have high expectations for recovery had a good outcome. So your role should be to give a lot of hope to the patient. Allay or remove all the anxieties, all the suspicions, fears. You have to do that. Even in my limited practice, I have seen when the patient has a positive outlook, they do very well. So reassurance is very important. Every minute you have to reassure them. Drugs, yes, these are drugs we use, and here I think the correct drugs are used, NSAIDs, and I'll come to it in a moment. Another important point is discourage bed rest. I don't know how much you have the experience. In my experience, sometimes sad to say, some people consult me and they say, Doctor, I have backache. I came to get a medical certificate. Nothing. They just say, I came to get a medical. I want 2 weeks leave. So we have to be very careful, because today as a research, a lot of researchers say that low back pain is, for low back pain, bed rest is not necessary unless you have those red flag features. I'll talk about it in a moment. So therefore, I think you have to sit with this patient because she's very worried. And we know she has to do all the work by herself. So I'm sure she might think, now who is going to look after my children? Who is going to tidy my house? So you can say, whatever you can do within your parents' limits, you do it. If anything gives pain, stop that. So you must say, don't stay in bed, but do your activities, what you have been doing within our normal limits, which again will give her some hope and confidence, and also give a lot of positive thoughts. She's in a lot of pain, but I think because always these patients always ask us why. Am I correct? Why did I get a doctor? My next door lady is fatter than me. She didn't have any backache. She's going to play tennis also. Why is it only me? They always ask. I don't know. I have a lot of experience with my pain. They always, why only me? They always ask. So I say, I can't answer that question, why it's only you, but you have got it. So you have to, I think, a little bit of, as you said, I will not waste a lot of time, but just to make her understand that posture plays a role, and that is a reason, so that whatever fear she has will be removed. So I'll give a little bit, I'll talk a little bit about the posture. And because she has even a lady who have been doing a lot of work at home, no help, so quickly I will show some pictures what I have with me. I'll talk to her a little bit about the correct posture of standing. I don't want to go into detail. I'll show some pictures and say, this is how you should do, and I will tell you, look at that, see what's happening to your spine, getting curved, and that can cause low back pain, just to make her understand the importance of posture in lower back pain as a cause and also as a preventive and as treated measure. She's a lady who does a lot of work seated. She has to sew. She has a lot of work seated. Take the homework of the children, do the kids' work, so she does a lot of seating. Lying down, I think you asked me about lying down. Well, again, what we recommend now is the mattress should not be sagging, so that when you lie down, the spine should be straight. So if you don't need to sleep on a plank or a hard surface, it's very uncomfortable. That will, disturb the patient more. So you can have a mattress, whatever mattress you are having should not sag down. It should not sort of bend down. The spine should be fairly straight. That's what I say. So very thick foam rubber mattresses are bad because they are very soft. It just sags down because you know your heavy area is the buttock area. So if you have a very thick mattress, your buttock area sags down. That means your whole spine is like that. Means you're like that for about 4 hours. If you stay like that even for 5 minutes, you get a backache. You know that. When you watch a match in awkward posture, you get a backache. So
You recommend why they are having pain or
routinely, I tell all my patients, because now they are to show that people who sleep on firm mattresses get less low back pain. So I think they should go to the school children as well, because all today when people talk about beds, they talk about the thickness of the mattress. So routinely they think a thin mattress will be more back friendly. And if they have back pain, people have gone to research has shown that if you sleep with 2 pillows under the knee, with the knees a little bit bent, all our back structures are relaxed, so that the tension, the jamming, everything gets quite relaxed if you keep 2 pillows under the knee. So if you are a person who likes to sleep looking up, you can advise them to use a very thin pillow and having 2 pillows there. That will relax all the structures, because in this lady, she had a lot of tenderness in the lower lumbar region, which means her fascia, her ligaments, everything's jammed and they are loaded. So this will ease off the load and that will relieve her. If it's a person who wants to sleep to a side, you know, all of us have our ways of sleeping, then you must always tell them to, please remember, my topic is lower back pain and not neck pain. But remember, this is the correct art of sleeping. Always remember the pillow must cushion this gap between the neck and the shoulder, right? And also when you are sleeping, if you can keep 1 or 2 pillows between your legs so that your hips are not too much interrotated, keep the thighs straight, that also get a relief. So you can just teach her about the correct postures or pain relieving postures, which will give her a lot of relief. A lot of things, just a little bit of education about the correct way of lifting things. And of course, I cannot overemphasize the importance of losing weight. People ask for physiotherapy. We do not recommend physiotherapy in the acute stage, but nowadays many people do not use. But when I recall my kid days in the 60s and 70s, I can remember my uncles and granduncles, all of them had a hot water bottle. And today, again, research say that it may be helpful to relieve pain. So if you have now I don't think whether you can buy these things. This will be a good measure to ease off your pain. Coming back to the management, which I'll give about a few comments. I think we have to, I'll pay a lot of attention to reassurance, and I will tell the patient, even if she doesn't ask, I'll say, go back and do whatever work you can do within your capacity. I'll say not to be in bed. Because sorry, I didn't bring that slide. There are slides to show that people who do bed rest or who spend time, most of the time of the day, resting in bed with acute back pain have a longer period of recovery than people who do their day-to-day work. So bed rest in acute backache without those red flag problems. Can you remember the red flag problems? Yes. If you put them into bed, you are in fact doing more harm to them. It's going to be a big problem. It's like putting a collar to neck pain. Sometimes you can't remove the collar. So I will always discourage bed rest. Treatment. This is the treatment which was given. I would prefer to add a paracetamol, because there is some evidence to show that when you add paracetamol to the NSAID, that gives a better analgesic effect. Piroxicam, again, I'm a little bit reluctant because she's an obese lady, and obese people can have things like reflux and they can have problems. I will use a different NSAID in that sense. But I will always add a paracetamol. Diazepam, again, you can remember I told you how to put the patient prone and feel the back. You have to feel the erector spine. If you feel when you keep your palms and slowly come down, sometimes you can feel very hard areas which are tender. This is muscle spasms. If my patient has got evidence of muscle spasms, yes, I'll be using diazepam. Otherwise, I will be reluctant to use that because that sometimes can make us sleepy and keep in bed. And that can give a sense of ill health. If you talk to people on diazepam, sometimes they feel ill. And because always you must give the positive feeling for this person. I will avoid diazepam unless she has got a lot of muscle spasms in my clinical evaluation. This is what was given. Yes, yes.
What about local energies, applications,
Yes,
and
you can do that. Yes,
especially in the Sri Lankan.
Yes, if there's a lot of local tenderness, you can do that. Like the hot water bottle, you can keep a hot water bottle. You can ferment with some warm water, wipe the water, apply some local. There's diclofenac gel, which is very good. Apply that and give a little massaging. That is good if there's a lot of local tenderness.
I feel in our Sri Lankan practices they
like that.
They
want
that.
that.
Yes.
Very true. I do agree. Thank you, Dr. Hanifa. Yes. Again, now sleeping on the ground is a bit of a problem because if you just for a moment think, see, if I want to go to the ground, say now I want to sleep on the ground, there's nothing wrong with the ground. The problem is the transfer. When you transfer from the standing to the lying down position on the ground, you have to bend your spine. And sometimes that can be harmful to the spine. So therefore, they say sleeping on the ground is not a good recommendation because of that reason, because you have to bend in your toes and then you have to slide onto the floor. During the process of transfer, you can sometimes load your structures and cause more back pain. So therefore, people come and ask me, I discourage them sleeping on the ground. Then bathing, yes, again, I think I'm very happy, Dr. Shekhar, you mentioned about using a bucket to bathe, but you must ask me use a very light cup. Because again, research has shown that if you sit and bend and lift something, there's enormous amount of pressure developing in the spine. I couldn't bring that slide, I'm sorry. About 15 years back in the United States, there was a physicist who coupled with a rheumatologist and did some research. What he did was he inserted some small needles and recorded the pressure differences or the pressure difference of the spine, lumbar spine at various levels in various activities. And it was very interesting to note that the highest pressure which should develop in the spine is when you try to sit and lift something. So therefore, if you are sitting and taking a bath, ideally someone should pour water to you, or you must use a very light cup. Because bending and twisting is a very important cause of low back pain, because bending and twisting can damage your structure. She already has a lot of tenderness, so I will be very careful to advise the method of shower will be the best, but if not, I'll have to address that issue as well. Over to you.
Thanks again. Now for the follow-up visit. In 5 days' time, she comes back, says the lower back ache is very much better, very mild pain persists. The treatment given by me at that point of time was paracetamol, 2 tablets 3 times daily for 5 days. I again spoke to her about the lifestyle modifications just to make her remember what was told during the last visit. And I spoke a little in detail about the weight reduction and advised her to walk when possible, then using a 3-wheeler. Spoke of the importance of weight reduction, which would be beneficial in reducing the strain on her back. And she reports that her younger sister from village has come to help her with the housework. That was a heartening bit of information for me. But then the worrying thing is husband still missing from the scene. Over to you, Dr. Lalit.
Thank you. Yes, I quite agree with Dr. Sheikh at this point, since she has less pain.
Sir,
minimal.
may I interrupt
yes,
you? Now, in the interim, this 5-day visit, what steps did you take to safety net? If something went wrong and your treatment didn't work, in your education, did you tell her anything specific? Say, he spoke, Dr. Lalit Vijayaratne has spoken about the red flags and so on.
Right.
So what in case that developed in the interim period before this visit?
Yeah.
Now, as a primary care physician, I think it's our duty in the education process to mention these things very specifically. So in that context, I'm wondering whether if you got the pain, do these investigations and come to me or some advice like that.
Normally in my practice, what I normally used to do is, always I used to say, if by some chance you are not getting better, please get back to me or call me within about 2 days or 3 days time. So is that what you are meaning?
I think, yeah, that is very important to, I
Right.
think, to emphasize to
Yeah.
this audience.
Point taken.
And also, I think what you can tell the patient is that if her pain gets worse, or in addition, if you develop any symptoms, better not, I will not mention the long list because she can't remember. I'll say any change, not only getting worse, any change, please come back to us, or you can give your phone number, then she can call you. Yes, yes, point taken, I do agree.
Now that we are on safety issues, I think NSAIDs, if you're putting a patient on NSAIDs, you have to look at a lot of aspects. Starting with, of course, comorbidities which she doesn't have, but any medication which she is on. Is she an asthmatic? Does she have hypertension? I mean, you need to highlight those areas. And also how you're taking the medicine. That it should be taken after meals, followed by a glass of water, and not to lie down for about an hour after that. And when they come back, like the safety netting that Hanifa was talking about, to warn them about, passing dark colored stools. Right. So to keep a lookout on those things.
Yeah, I think those are the routine things that we should mention, yes. Yes. So again, I will re-emphasize the importance of, since she has less pain, now she is in a more receptive mood to take your advice. So you talk a lot about the posture discipline and preventive measures. Coming back to this, I personally feel that she doesn't need paracetamol because she is much better now. Because I have the feeling when you prescribe something to a patient, they always have the feeling that they are still ill. So since she says she has hardly any pain or little pain, I will say stop the drugs I gave you, but you can take paracetamol only if you have the pain on a PRN basis. That will give the patient a sense of confidence that she's recovering. Because always my objective, a lot of positive thoughts that she's in the correct direction. So I will just keep it, if necessary, only. Over to you.
Can I come in on that one? We are in a competitive field. General practice is in the private sector. We have got so many of our colleagues who are practicing, and there is nothing to prevent our patients from walking across and taking treatment from another colleague. Nothing wrong in that, but this is also a concern that maybe SOS will solve it. But I have had a lot of these problems. The patient is quite dissatisfied. I mean, I'm not saying that we should encourage medication, but this is a small aspect of general practice.
Thank you. Now patient returns to the clinic after about a month, and she says that she was just on and off having very, very mild pain. She didn't take it very serious, but then what has happened?